Welcome back, ladies and gentlemen. You're still watching the Nile Cruise, and now we're going to talk about the health sector and the revitalizing Egypt's healthcare infrastructure. The Ministry of Health has launched a comprehensive national plan featuring 348 projects with a massive investment of 113 billion Egyptian pounds. From the medical city for research to strategic drug security, this plan aims to redefine medical equity in Egypt. And to shed more light on this topic, we are delighted to have with us Dr. Islam Anan. He's Professor of Health Policy and Health Economics. Thank you very much, Dr. Islam, for joining us today, Nile TV.
My pleasure. Always a pleasure to be with you in the show.
Thank you. Dr. Anan, how does this 113 billion pounds investment serve as the financial backbone for the Decent Life Initiative and Egypt's long-term development?
It's a very good question to start our conversation. So if we are talking about financial sustainability and healthcare funding, it is very important to mention that every pound which is invested in the healthcare is not just for social aspect, it's economic aspect as well. So having Haya Karima to invest specifically in having a good healthcare equity is very important. And the projects itself, the 248 projects, it's actually the main reason is to have health equity. Health equity, we are talking about if a citizen living in a rural area, for example, and the focus was actually for Upper Egypt, they got the fair chance to reach a healthcare facility. They got a fair chance to reach a primary care. There is no commute time. Before, we all the time talking about the commute time from a governorate to another governorate, from a rural area like Wahed, for example, to commute all the distance to reach the neighboring city to have a simple healthcare services. Now we're talking about around 2,500 villages under Haya Karima taking this benefit from the projects, having access to healthcare. It's actually a pillar among the healthcare vision of Egypt. If we are talking about the vision of Egypt, for example, in 2030, we're talking about having a person centricity. The person centricity, it's the main focus is to switch the mindset of the healthcare from just treating patients. Previously, we were just treating patients, trying to see whether we do have a tertiary care or not, trying to provide only treatment. But the person centricity is trying to make people more healthier, even if they are not patients yet. So preventing diseases is very important. Early diagnosis of diseases is very important, what we call a secondary prevention. So having all these projects serves like equity to start with, and serves another important point, which is solidarity. So it's very important to mention that if anyone is underprivileged, they cannot actually finance themselves in the new healthcare structure or the old healthcare structure. The country itself will be subsidizing services. The country itself will be paying on their behalf even, and they are paying 0% as a co-payment to receive the service. And this is important because currently, while we speak, we do have a big percentage of out-of-pocket. We're talking about around 55% of healthcare budgeting is coming out of pocket from the Egyptian citizen. And the main aim of the Egyptian government and the Minister of Health is to decrease it by 2030 to reach only 20%. So there is no burden on the Egyptian pockets, and specifically there is zero burden on the underprivileged, which is the main focus, which is 88% achievement in Haya Karima for the underprivileged citizens.
Okay. Dr. Anan, talking about the medical city, how will the new medical city bridge the gap between scientific research and the actual patient treatment?
Another good point. If we're talking about the medical city, it's not a hospital. We're talking about an integration.
It's a big city.
It's a big medical city. Usually big cities for medical and healthcare, it's all about having good research facilities, which is very important. We do have tons of data. And investing in research and having data which can be actually transformed into good
and practicing
healthcare
on patients.
Information, that's the second pillar. Having all the patients treated with enough data to have good clinical research and good infrastructure of data, which is actually it's a treasure on its own. Having data, you can utilize it to make better decisions, informed decisions. You can utilize it having better reports and better planning. it will be transferred at the end to have better efficiency in terms of financial sustainability as well. Another point in any medical city, and this is the main focus, is to have an integrated services for treatment, for management. So having all the labs in one place, having all the operational operation room, the ORs in one place, and expansion in the beds, whether the normal beds or the ICU beds. It is very important that the patient is not referred to another place. It's one place where the patient can be served for all services, starting from the lab and imaging to operations till the after operations management, and most importantly having all the sufficient medications as well inside the medical city, and having the multidisciplinary approach. Multidisciplinary approach, it means to have all the specialists, tertiary care set in one place. To give an example, for example, if a patient is going for a kidney transplantation, we need a cardiologist to check whether the case itself is eligible and suitable or not for the transplantation. We need an anesthesia specialist to make sure that the patient is actually eligible for that. We need a surgeon who's going to be doing the operations. We need a nutritionist to actually taking care of pre and after the transplantation itself. We need a clinical pharmacist making sure that any medication the patient is actually taking is not contraindicated with the transplantation medications, which is huge.
Of course.
So that's one example for the multidisciplinary approach in a medical city, and Egypt is expanding in the medical city approach. We can see it in the Nile medical city, in Mahad Nasser. We are seeing it in the universal health insurance, the new universal health insurance, and the cities they are providing. And we can see it even in specialized centers, whether for ophthalmology, cardiology, and so on.
Dr. Anan, in what ways does expanding to 348 projects nationwide transform the healthcare into a national security shield against future pandemics?
So we can remember COVID days. In COVID days,
we didn't forget yet.
And I hope it's not going to be repeated. But during COVID, the main focus was the supply chain disruption. And that's why the supply chain is actually a national security. Which countries managed to focus during COVID on having a good sustainability in terms of supply, and managed to go through the COVID pandemic with the minimum damage? The countries where you can find local manufacturing and you can find a good warehousing. And in Egypt we are manufacturing 93% of our local needs from pharmaceutical and medical supplies, which is a huge percentage. Only 7% are actually exported. That's why it took us like a couple of months, and then we redirected the factories to produce COVID medications, COVID supplies, and we managed to maintain the disruption, the global disruption happened in the supply chain and export and import dilemma. And having said that, the main focus now is to have the power. If we don't have the power on our local manufacturing and in our strategic supply of medical devices, in medications and all the necessary for future pandemics, for current, for example, flu season, we're not going to be able to sustain it, and we'll find a lot of shortages. And we've seen a lot of shortages worldwide in a lot of countries, and we don't want to be in the bottleneck of the supply chain. So having said that, Egypt actually launched 6 warehouses all around, nationwide, all around Egypt, to make sure that we have minimum of a 6 months supply for any necessity. We do have, of course, 2 categories of supplies. We do have the necessary medical supplies, which is must be there for at least 6 months, must have, and we do have the complementary one. So the medical manufacturing, the medical storage, and the warehouses, and making sure that we do have a good localization profile are actually the main pillars of having resilience in supply chain. And this is the focus of Egypt in terms of production. That's why we will find a lot of memorandum of understanding are actually signed between the Egyptian government and the Ministry of Health and the private sector to make a technology transfer from the European and the American plants, healthcare plants, to be able to manufacture it here, and not only for local consumption, it's also for exporting to Africa. We can be a hub for Africa. Africa, on the reverse, they are producing around 10% only of the local needs, and 90% is actually exported.
Yeah.
So we can be a good hub. Africa can be a very good market for
For us.
exporting for Egypt.
Yes,
Yes.
of course. Moving to the self-sufficiency in blood and plasma, which is considered a major win for Egypt's medical independence. We would like to talk more about this.
Yes, that's another very strategic product,
Mhm.
and we used to actually export it fully.
Mm.
And Egypt was the pioneer of having the plasma project here, whether for donors and sending the plasma outside to Spain and then getting it back as product.
Mhm.
It's very important that we do have currently a good supply. We started to have the supply, local supply, as 100%. It will be our target in the next couple of years.
Mhm.
So we'll be building even the plasma and the processing inside Egypt.
Yeah.
So having albumin, for example, it was a
Yeah.
very strategic product, and we had a lot of shortages in albumin.
Yeah.
Currently, we are producing 100% of our needs.
Mhm.
Currently, we are getting from the company in Spain where they are actually processing the plasma to get the products. And the future step is we're going to be processing that even inside Egypt. And
That's
a
great.
very big applause and thank you to the Egyptian citizens, because we managed to go through the plasma project, because the number of donors in Egypt is actually huge. Egyptians donated plasma, and this is the cornerstone of the project.
Yeah.
The donors themselves, the Egyptian citizens who believed in the case and went to the plasma centers to donate there.
Yeah, of course. Dr. Islam, how will expanding the family medicine centers reduce the pressure on our major hospitals and improve local services?
Okay, so as Egyptians, and maybe we can relate,
Mhm.
usually when someone got some pain in their stomach, they would go to
To
a
the hospital.
gastroenterologist.
Yeah, yeah.
They got some headache, they go to a neurologist, for example.
Yeah.
And we got used to that. Go to a
Yeah.
tertiary specialist,
Mhm.
and we do have just simple symptoms.
Yes.
The core of a successful healthcare is to have a primary care,
Yeah.
a family practitioner, a
Yeah.
general practitioner who can
Yeah.
actually make a
Like
differential.
abroad.
Like abroad, yes,
yeah.
like the NHS, for example,
Yeah, yeah.
which is suffering heavily from having
Yes.
a good primary
Queues,
care.
long queues.
Yes, we are talking about 2 million waiting list currently
Yeah.
in the UK.
Mhm.
And by the way, our waiting list is around 2 months. You empty your waiting list every 2 months, which is another success story we can relate to in the
Yeah.
future. So the family practitioner and primary care is the main aspect if you would like to decrease the burden on
On
tertiary
the
care,
hospitals.
on hospitals, on specialized hospitals.
Yes.
So all citizens can go first to a primary care, and this is the cornerstone of the universal health insurance,
Yeah.
serving currently around 6.5 million citizens, and second phase will be serving around another 9. The main thing is to go visit a primary care, and maybe it can be resolved at the primary care level,
Yeah.
and if not, to have a good referral system from the primary care to the secondary care,
Okay.
and if needed to the tertiary care. And then the tertiary care can decide whether we need a neurosurgeon, we need a gastroenterologist, we need, for example, a gyna, OB-GYNA. So the main, like 70% of the main reason we are going before to a specialist can be only resolved just at the primary care level.
Yes.
So having, for example, a lot of centers, we are talking about 200 plus primary care centers in the second phase to be actually built, making even the physicians able and willing to work as a primary care or family practitioners. In the past, most primary care physicians were aiming to become a tertiary care specialist, and they don't settle to have a career as a primary care.
Yeah.
Now, with good salaries and a good retention plans, a lot of family practitioners, because you can take your PhD as a family practitioner, are actually settling down to be a family practitioner, which is, by the way, a very difficult branch in science.
Yes.
It's not an easy one.
Yeah.
They don't need to become a specialist. Just settle as a family practitioner, get paid well, and because worldwide we have shortage in family practitioner in general. That's why you will find a lot of countries are trying to get our physicians from here.
Yes.
You will find a lot of offers from European countries, from Gulf countries, for the family practitioners in
Yeah.
Egypt,
Especially England.
especially England and Germany. They're taking around 4 to 5K of family practitioners from Egypt every year.
Yes.
And to stop that drain, That's why the universal health insurance, for example, increased the salaries, and
Yes.
most important than salaries, because when you ask, I'm just back from UK, when you ask the physicians there, it's not about financials only, it's about having more time to study, having more
Yeah.
time to make my PhD.
Mhm.
And when you give them time, and you give them security inside hospitals,
Yeah.
and a good salary, you will be able to retain them inside.
Of
That's
course.
why the main focus of Egypt from universal insurance is to have a good primary care network before you do a referral system. Of
Yeah.
course, augment that with digitalization, good governance to control the process itself, and you have a successful health insurance.
Okay. Dr. Anan, how does linking the university hospitals to this plan ensure our medical students are trained on world-class technology?
Okay, so linking university hospitals and educational hospitals is very important for research,
Yeah,
research and learning and development.
of course.
And in Egypt, we're lucky. When you go to any country and ask medical students or the interns, they're gonna tell you I see like 15, 20 patients every day. In here, they can see 100
Yeah.
plus patient every day. And this is very important for learning.
Yeah.
The most important thing is to have this learning in terms of data and in terms of learning seminars, having continuous seminars inside the hospitals, the main focus, having good research, investing in clinical research as well for the educational hospitals, and having registers. Medical registers are actually very important to the process. And the medical city, for example, which we discussed in the first question, it's linked as well to education, it's linked to research. It's linked to having the medical student watching the consultant treating, but not only treating, documenting the case. They can refer back to the case a month after, couple of years even after, and having a good continuous, we call it longitudinal health registry,
Yeah.
to be able to make sure that if I've done, for example, a triage, whether the triage in the treatment was successful, I'm improvising that, I'm giving empirical treatment, the empirical treatment was successful or not. So tracking even my work is the main learning step in for any intern, for any medical student.
Yes. Dr. Anan, we would like to talk more about the jobs for Egyptian youth and what is the impact of these hundreds of projects stimulate the local economy and create the specialized new jobs for the youth.
There's a very fast answer for that, and there's a detailed one. The fast answer is linking healthcare to economy is actually a very old story. It's a
Yeah,
theory.
yeah.
Once you have a good healthcare, you have a good productivity. And you have a direct impact, which is investing in healthcare. You will find jobs for medical field,
Yeah.
for doctors, for pharmacists, for nurses, all medical background professions. But there is a bigger picture, which is the productivity itself. So every pound you are spending in healthcare, it got a return on investment for the economy itself. For example, in preventive care, it can return to economy about 14 pounds.
Yeah.
If you are talking about tertiary care, there's a lot of examples. For example, if you invest in cancer, for example, management, you will get a 2 pounds return on investment. You will find a lot of jobs because the healthcare itself is better. And we've witnessed during COVID, for example, when you have an impact on healthcare, we lost in 5 months 1.5 trillion US dollars on a global level. So healthcare equals good economy.
Yes.
If you have bad healthcare, it's a bad economy. And all the time we were thinking that investing in healthcare, it's like just consuming money.
Yes.
No, you are investing money. The
Yes.
new word is investment. The health investment is very important because, for example, you have a better quality of life. People can work better.
Yeah. Can perform.
Hepatitis C, for example, we were draining billions every year because of hepatitis C. Once you eradicated hepatitis C, and all the people mentioned we spend around 2 billion to eradicate hepatitis C, but actually every pound spent on hepatitis C returned to the economy around 4 Egyptian pounds.
Yeah, and also talking about the economy side, tell us more about the medical tourism in Egypt. People coming from abroad to be cured here. Tell us more about this, doctor.
That's another aspect, a very important one, and a good revenue stream for foreign currencies.
Yeah.
And we were talking about how medical field here are actually experienced. They see a lot of patients. We are talking about facilities. We have medical facilities, and we are talking about having fast process. You mentioned the waiting list in UK, for example.
Yes.
We don't have a waiting list. So patients can come here, they can enjoy the sun. It's
Yeah, the
Jan.
vibes.
It's already Jan in winter
Yeah.
and we're enjoying the sun and the
Yeah.
vibes. They can actually get the treatment very fast. Good hospitals, our medical physicians and medical field professions are actually a role model for all the world. They are actually getting a lot of offers worldwide. And finally, you can have it as a source of tourism as well.
Yes,
And
medical tourism.
the investment itself going to be expanding till 2030 because the vision of health tourism is to
Mhm.
have designated cities for medical
Yes.
tourism.
Yeah.
Whether in Cairo, whether we are talking about Wahat, in Sharm el Sheikh, in Hurghada,
Yeah.
where people can come spend a week and we call it an end-to-end journey. They're
Yeah.
going to be starting that from the airport till they reach the airport back to their country.
They will have an amazing experience.
I'm sure of that.
Dr. Islam, one final question about looking ahead to 2026. How will the experience of a patient in a rural village differ from what it was 5 years ago?
And this is a perfect question to close our interview. And if you are talking about the patient experience and the patient navigation, it's completely different. If you are talking about the patient 5 years ago in the rural area, there was no reach. And by reach, all
Yeah.
the time segment healthcare into access and reach. Access where you build hospitals and reach where the patients can actually reach the hospital itself. And we can see a lot of primary care, especially if you are talking about the cities. We have the universal health insurance implemented already. They can reach primary care more easily, and then if they need to be referred, they can be referred to another city. And even though they can have an online Zoom meeting with the
Mm.
consultant before even the referral itself.
Mm.
This is a huge improvement and a significant improvement to the patient journey, where we are actually hoping in
Yeah.
2030 where the implementation will actually reach to Cairo even for the universal insurance, and end by
Mm.
2034 to have this
Mm.
to all the Egyptian citizens, inshallah.
Well, Dr. Islam Anan, the Professor of Health Policy and Health Economics, thank you very much for joining us today in Nile TV. Thank
My
you,
pleasure.
Doctor. Well, ladies and gentlemen, short break. I will be back.